بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is about short talk about the Omental Cake. The omentum and mesentery and the bowel are frequent sites of metastatic seeding from primary malignancies, like gynecological malignancies, particularly ovarian and endometrium, and the primary malignancies involving the omentum and carcinoma of the stomach, colon, pancreas, appendix, and other. Omental caking of a tumor arising from intraperitoneal seeding of tumor cells, followed by invasion of the serosal layers and subsequent growth. The symptoms are typically vague and non-specific, which can allow the process to progress unchecked, with the omental replacement by confluent soft tissue mass lesion. Also, we should not forget the omental caking can cause by infection like TB, or can cause by another rare causes like myelofibrosis or other causes. Here are some examples of some of the causes of the omental caking. As we see here, omental caking on the left side of the upper abdomen as due to colon cancer in this old man, and we have some ascites here. As we see also thickening of the overlying peritoneum. Here, this is another patient with omental caking, as we see here in this patient due to ovarian cancer. Here, another patient with omental caking, as we see multiple nodules with ascites due to pancreatic cancer in this old man. Here, this is another patient with gastric cancer and with omental caking, as we see multiple nodules and with thickening of the omentum in that area, as we see. Here, this is another patient with omental caking, as we see here, with ascites, and we see here due to this patient with metastatic adenocarcinoma. This patient with ovarian cancer with omental caking, as we see here, and we see a large amount of acidic fluid. This patient also has omental caking, as we see here, 1, 2, 3 nodules seen, and the disease is progress after 3 months, and you see a large amount of omental caking with ascites, as we see the patient developed ascites, and the patient underwent partial omentectomy treatment for omental caking. This patient with also mental nodules, as we see here, and this patient with endometrial carcinoma with intraperitoneal seeding and hepatomegaly with metastasis and large retroperitoneal metastasis also. Here, this is Omental caking. As we see, we should not forget infection as a cause of mental cake, and the infection here in this patient, like TB, and the infection can be hematogenous or lymphatic or direct spread of the infection. And in this patient, we have TB with low attenuation omental nodule, large nodule as we see here. Sometimes we cannot differentiate the infection from metastasis and we should do biopsy. Here another patient with omental caking as we see here, and we should also not to forget rare causes of omental caking like myelofibrosis or extramedullary hematopoiesis, and in this patient has omental caking due to myelofibrosis. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.